The COVID-19 virus has been with us for the most part of 2020, causing close to 2 million deaths worldwide and a lot of job losses. Different countries adopted different precautionary measures in fighting this deadly virus, which resulted in lockdowns, compulsory wearing of face masks, keeping a safe distance from each other, among other measures. Recently, cases of more contagious variant of COVID-19 was identified in the UK and now confirmed in other countries in Europe. This has triggered travel restrictions in and out of the UK and in other countries. With the increase in the rate of deaths, Elizabeth Senna Amuji, a nurse in Sweden, gives reasons why the virus should be taken more seriously by everyone.
A lot of my colleagues have contracted this virus and they are badly sick, they can't eat, they have lost smells, they can't smell anything around them. And that is even get to tell you how dangerous it is, because if you can't smell anything, it means that even if there is fire or something is burning around you, you will still feel like it's normal and something could happen to you through that.
She says neglecting the safety protocols in fighting against the virus could affect other people around us.
People who are neglecting this virus, they just feel that it's something that is going around and it will stop by itself. Those are the people who affect people who are at a great risk. Because the fact that I have a good immune system doesn't mean that the person next to me have the same immune system. That is why it is important that we try to play a major role and follow every regulations concerning this virus.
In the beginning of the COVID-19 pandemic, some people, including Charles Mensah, did not fully believe that the virus was the cause of many deaths, as was reported.
No, I mean, said I need say, I was in a say 5G, this is say, I didn't know, be a Canadian. I mean, sometimes it makes you be more company or more wound or more by now or more county count because none numbers in it was so hard one.
Mensah, who later became infected with the virus, shares his experience and some of the symptoms he had.
Me made any say no, or on mass a drew a numera na like me ho chere me more. Starting on na me ntimi enkasa yi e che no na as a cent crampo me cent cra e che no na me chinkasa ya me ya hard one.
He advises people to stay at home and, if possible, avoid going to public places.
Yeah, obi a onya bi me dey ka chere pa say o hwena we o ko no fa so bi afri suma ehun hia so beko because you only pay you on crumpo no be nanti ba onya bi na you obi on kra woni ni bones a ho kra wo na achina atorum gidigidi.
During the peak of the pandemic, many countries locked down its borders to commercial travels. And after months of border closure, the government of Ghana decided to again open its international air borders. Passengers arriving in Ghana were required to possess a COVID-19 negative PCR test results 72 hours before their departure to Ghana. On arrival at Kotoka International Airport in Accra, passengers are again required to undergo a mandatory antigen test at a cost of $150. The government claims that the antigen test of arriving passengers is helping to save lives against the spread of the virus. Many Ghanaians abroad have expressed concern on the cost of the antigen test. Samuel Lamte, a Ghanaian resident in Sweden, says the government of Ghana has done its best in the fight against the virus. However, he believes that the cost of the antigen test is appalling.
In the situation where passengers who arrive in are mandated to make a payment of $150 for a COVID test, it's rather very outrageous in the sense that most European countries are not taking a dime, they're not taking a penny for that. Because trust me, this COVID issue has really affected a lot of people, especially their jobs. Some people are coming home just to relax themselves.
Lamte believes that the test should rather be free for everyone.
In fact, it should be free. In the fact, it should be free. But if they should take any money, I mean, $20, $50 should be enough. To me, it looks like someone somewhere wants to make money out of this.
However, the government has said that the fee is reasonable compared to global charges. In April this year, the Ghana government went for a $1 billion relief fund from the IMF in the fight against COVID-19. In addition to this, many individuals and organizations donated to Ghana's COVID-19 Trust Fund to support the fight. Here in the Scandinavian region, the Ghanaian communities in Sweden and Denmark made donations through the Ghana Embassy in Denmark to the COVID-19 Trust Fund.
The Copenhagen mission appealed to Ghanaians in the diaspora, specifically to our accredited countries. And I'm very happy to say that they listened to our call and they have made a modest contribution towards the COVID-19 fund.
Lamte believes that charging a COVID test after donating to the trust fund would discourage Ghanaians in the diaspora to continue to financially support the government when the need arises.
So if we are all supporting the government of Ghana, and the government of Ghana is using another angle to take money from us again, I mean, next time when you tell us that, hey, let's make donation to the government of Ghana, I mean, we wouldn't do it with our heart.
The antigen test, which is the one done in Ghana, is faster and cheaper than the PCR test that arriving passengers to Ghana are required to have. Joachim Sian, a medical researcher into cancer biology, compares the two different tests in relation to COVID-19.
The difference has to do with sensitivity. Sensitivity is how much of the virus do I need to have present in order to detect the virus. With the antigen test, you need more virus to be present before you detect it, whereas with the PCR, just a little amount of the virus is just enough.
He says that an antigen test can be a standard for detecting whether a person is infectious or not.
So when you are negative for an antigen test, but maybe you were once infected and you are negative for an antigen test, it means that you are less likely to infect people. But once you are positive, there's a higher probability that you can infect people. PCR cannot tell that. Because PCR, whether you are now, even when you have just a little virus, when you can infect people, it will be positive. So PCR can't tell you which phase are you in the infectious phase, but antigen tests can actually give you that information.
According to WHO, the time from exposure to COVID-19 to the moment when symptoms begin is on average 5 to 6 days. The window from the time of possessing a negative PCR test results till the time of departure to Ghana is 72 hours at most. And for this, many have questioned whether passengers will even have enough viral particles in the nose or saliva to be detected by an antigen test. Sian analyzes the situation and explains what could happen within that time period.
If maybe you are in the early phase of incubation, so you are infected today and you do the test today, you may be negative today. 3 days later, your viral load starts to pick up. There is a certain threshold that you can reach and get antigen test to be positive. So it's a little bit complicated, but it depends on the scenario. Are you truly infected? If you are not infected and you are negative for PCR, you will definitely be negative for antigen.
He also says that having a negative antigen test results does not guarantee that a person does not have the coronavirus.
A negative test is not an absolute certainty that you don't have an infection. So that is why it is always recommended that when you move into a new area, quarantine 14 days. And the reason is that the incubation time for the virus is 14 days. So if you truly have no infection, by 14 days, you'll get to know. In 14 days, if you're infected, your symptoms will begin to show.
As EU is launching a coordinated vaccine rollout to fight COVID-19, the government of Ghana has promised that Ghana won't be left behind in having access to the vaccines. It says it is committed in deploying effective and safe vaccines to the people of Ghana. The government has also updated its COVID-19 guidelines for passengers arriving in Ghana, where children between the ages of 5 and 12 will now undergo testing on arrival without any charge. Many Ghanaians are hopeful that the cost of the antigen test will be reduced or erased entirely as we enter 2021. Sima Boahen reporting.